Welcome to Think Tank. I'm Steve Adubato. Everything you needed to know, want to know about diabetes. We're going to find out right now. We're joined by Jaymie Santiago, President and CEO, New Brunswick Tomorrow, and Manuel Castaneda, who is Director of Community Health at New Brunswick Tomorrow. You may ask, what does New Brunswick Tomorrow, which is a community-based organization in beautiful New Brunswick, New Jersey, have to do with diabetes and diabetes awareness? Jaymie, what's the answer?
Well, we're an organization that serve all the needs in the city, and so one of those needs being diabetes. And so what we know in New Brunswick is 1 in 4 households has somebody in the house with diabetes, and so it's a problem. And so as an organization committed to improving the quality of life of everybody in this city, one of the things that we look to do is to help. And so diabetes is one of those big issues.
It's interesting, whether it's Newark, Jersey City, New Brunswick, Trenton, Camden, or the other states we're seen in urban areas, is the incidence of diabetes higher in urban areas?
Absolutely. And when we talk about New Brunswick that has a significant number of Latinos in terms of the population, it mirrors what Latinos actually go through in terms of top health issues.
Across the country?
Across the country.
Because?
It comes from, eating, ability to buy nutritious food, just a whole myriad of what we call social determinants.
Social determinants of health. A lot of our colleagues in the healthcare world keep talking about that. And housing is a piece of it.
Absolutely.
Transportation, a piece of it.
Yep.
Wealth or the lack thereof, a piece of it. Talk specifically about what your organization is doing to help. By the way, you'll see the website for New Brunswick Tomorrow, as well as a website for our colleagues and partners at the Berry Foundation, who are really leading this initiative and trying to create more public awareness. Talk about exactly what your organization is doing.
Sure. So we're partnering with the hospitals in our community. So that's
St.
Peter's University Hospital and Robert Wood Johnson Barnabas University Hospital.
An underwriter of ours. Go ahead.
Yes. So they've partnered. They've walked alongside us to create a promotora program or community health ambassador program with us that actually employs New Brunswick residents to go out into the community.
The ambassadors? We're seeing some of the ambassadors out there now. So break this down. I mean, what exactly are they doing to help those who may be struggling with diabetes, or may not even know they're dealing with it?
Well, go ahead.
Yeah, that's right. So they're literally knocking on doors and talking to their neighbors. I mean, that is really...
Door to door.
Door to door. That's the most effective way to really talk to a community that, in a sense, has a barrier, or there's barriers in order to reach, right? When we talk about New Brunswick, I said we have a significant Latino population, which is also immigrant-based. New Brunswick is a port of entry town for, most of its history.
Is that complicated?
Absolutely. I mean, there's immigration anxiety, especially with the immigration climate that we have now. New Brunswick, unfortunately, has been a place where we've had ICE raids. So in order to reach the community, we have those barriers of fear.
Language an issue?
Language is
obviously.
So
how do you deal with that? How do you train the ambassadors to be prepared, ready to engage those for a whole range of reasons, immigration being one, but language being the other? How do you train them, get them ready to really connect with folks?
Well, they are from the community, so that's the part that they actually come in. That's their expertise that they come in with, that they have the language. It's their neighbors they're talking to. They know how to speak to them, right? They know the issues because they themselves are living these issues. So that's the importance in the expertise. What we provide to them is the training on the health issues so they can speak to that.
Right.
And then we work together to find that language or that common way of being able to talk about these issues in a way that they and their neighbors can understand.
I mean, how do you monitor the progress here?
Well, I mean, in the model that Manny is describing, our focus is making sure that we're reaching our community. And so we look at things at how many doors we're knocking on, how many people are answering those doors, how many homes we're actually stepping into to start these conversations with our families. And then we trust that our partners, St. Peter's and Robert Wood, are taking it to the next step when it needs to, making sure that they're seeing their doctors, that they're enrolled in a medical home, and that they're seeking the care that they need. And so in this relationship with the hospitals, which I think is pretty unique in a lot of urban communities.
Because you can't, a not-for-profit like yours can't do it alone.
We cannot, absolutely not. And so we're always looking for partners to come alongside us to help with the needs that we see that are affecting urban communities.
Make this a bigger issue, because Think Tank tries to look at national issues and bring them into focus in our community in the New Jersey and the tri-state area. But what's fascinating to me is diabetes is a national problem. There are millions of Americans dealing with it. There are millions of other Americans who are pre-diabetic. What does that mean?
That means basically people that are already, their blood sugars are going up. They're on their way, whether it's for predisposition or through just the way they live their lives. That it's already seen that they're on the way to becoming diabetic.
Why do you have to jump in early? Why do you have to get in early here as opposed to, well, listen, I don't have diabetes, devil's advocate here. I don't have diabetes, I'll roll the dice, I'll wait. Not a good idea at all.
Well, the thing about diabetes is once you have diabetes, it's a lifelong challenge. And so you want to get in early because once you have diabetes, not only does it affect you, but it affects the people around you, your families.
How so?
Well, I mean, a lot of what we see in New Brunswick is, a lot of the diabetes is caused by a lot of cultural misnomers. The idea is that, because I'm eating culturally familiar foods, that I should be okay. And yet what we know is that, there is a way to eat right. There is a way to eat healthy. And if we're not getting in early to have those conversations with families and the individuals themselves, it becomes a larger problem.
By the way, the Live Well campaign, is that the name of the initiative?
So the Live Well campaign is a broader communications campaign that we created in order to really promote available resources, events, and activities that are health or health related. So New Brunswick, one of our nicknames is the healthcare city, with all the organizations and entities that we have around health.
We're looking at Live Well activities right now. Go ahead.
We really want to make sure that our residents are taking advantage of what's available to them. And that was an issue. We had a lot of residents telling us initially we didn't know that this was happening.
They weren't even aware of it.
They weren't aware of
I want to
it.
be clear, public awareness, the role of the media in helping people in a variety of communities truly understand what is at stake, A, and B, where they can go for help and resources is huge.
Absolutely, it's critical. It's critical, and so can't deny the effect of media, the effect of social media, and where folks are getting their information. So we're trying to enter a market, so to speak, try to get information out there so that families know, individuals know where they can go when they need help, and making sure that that help is available when they reach out.
Jaymie, Manuel, we appreciate you coming and talk about this. By the way, this is a series of segments we're doing on diabetes awareness, frankly made possible through the folks at the Russell Berry Foundation. I want to disclose that. And also, next time you come in, let's talk about the housing piece of this.
Absolutely.
The big, talk about social determinants of health. Housing, affordable housing, New Jersey, one of the most expensive housing states in the nation, and healthcare. Gentlemen, thank you so much. Keep up the good work.
Thank you, sir.
I'm Steve Adubato. More importantly, this is Think Tank, and we will be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, RWJ Barnabas Health, NJM Insurance Group, the Fidelco Group, the Healthcare Foundation of New Jersey, Horizon Blue Cross Blue Shield of New Jersey, the Port Authority of New York and New Jersey, Summit City MD, and by PNC, Grow Up Great. Promotional support provided by New Jersey Monthly and by bestofnj.com. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.